So why do kids have to have their tonsils out?
You know, Randy, it's really for two primary categories. One category is these kids that can't breathe at night. Okay. And they snore loudly and they toss and turn and they're pretty miserable, and the parents will notice them having breathing pauses. So not every kid that snores needs their tonsils out by any means, but these kids that they're snoring and then they're stopping, and what the parents will see is they'll be breathing loudly or snoring, they'll kind of gasp, or they'll gasp and roll over. What's going on is their oxygen levels are going down, their carbon dioxide levels are going up because they're not breathing, and their body says, hold on, I need to breathe, so it wakes them up. So these kids are getting woke up all night. So that's the first broad categories for obstruction of their breathing at night, so sleep apnea. There are a lot of consequences from that, or can be. Some kids, that we call bruxism, is a fancy word for tooth grinding. So what they're trying to do, you'll see a lot of these kids, they pull the jaw out, right?
Yeah.
And so they grind their teeth, but they're not grinding their teeth out of habit. Now what they're trying to do is pull their jaw forward so they can breathe.
Interesting.
They're trying to overcome this big blockage. And then a lot of kids too, with their oxygen levels going down, we'll see kids that are older, say over the age of 6, they'll still wet the bed, you know. And I'm not saying that every kid that wets the bed when they're older is because of the sleep apnea, but there have been really good studies that show a high correlation. And I never operate on people for that reason, but if they do have sleep apnea and we resolve with tonsillectomy, that frequently improves. So the first is obstruction. Second is recurrent infection. And the current recommendations are actually more than you'd think. Okay. As far as the numbers, they have to have 7 infections, tonsillitis, throat infections, strep, all of that combined, 7 infections in 1 year, or 5 per year, 2 years in a row, or 3 per year, 3 years in a row. Now, there's some kids that have really severe complications like rheumatic fever. They'll have these big abscesses in their necks and things from these infections. Those are not common, fortunately. Now, those are kids or people in general, we operate on much more quickly because, you know, they obviously are going to have a major complication if we don't. But for most people, it's either blockage or infection.
Okay, and downtime for the kids these days?
It varies. You know, younger kids,
everything goes
it's easier.
great.
Yeah.
What is it?
Usually younger kids, it's 5 to 7 days. Older kids, teenagers or adults, it's longer. I mean, we usually tell them to expect a week and a half, maybe even 2 weeks, but a lot of times it's less.
And when we say downtime, we're just talking about soreness.
You know, they're pretty sore. I mean, yeah, they're really sore. They'll have some ear pain, really bad breath, they'll have a low-grade fever. I mean, it's not a fun operation for adults. For kids, they roll through it a lot more easily. We usually tell them to expect a week to a week and a half. If they come back and they say, hey, it didn't take that long, great. I'd rather it take, you know, them expect it to take longer and them do better. There are a few things we tell them to look out for in the little kids. You know, we make sure they drink plenty, they stay well hydrated.
What do they eat during the process of recovery?
That's probably the most fun part for the kids. You know, they go shopping beforehand, and it's like they get all the smoothies and ice cream and, you know, macaroni. It's most soft things, you know. Okay. Nothing that's spicy or citrusy or sharp. So ice cream, popsicles, yogurt, soups, noodles, mashed potatoes, smoothies, stuff like that. We tell them to make sure they're hydrated, and the other thing we tell them to look out for is just make sure they look out for any bleeding way down the road. Fortunately, it doesn't happen very often. You know, I tell folks in young kids it occurs about 4% of the time, which isn't zero. And, you know, if that happens, it's nothing I've done or they've done usually. It's just that when the little white scab back there breaks down and comes off, there can be a little exposed vessel that bleeds, just like if you have a scab on your elbow or knee that comes off. But if that happens, you know, they need to go right back to the emergency room. So that's pretty much what they can expect.